Assalamu alaikum dear doctors. In this video I am discussing von Willebrand disease VWD. So von Willebrand disease is a blood disorder in which the blood does not clot properly. Blood contains many proteins that help the blood clot when needed. One of these proteins is called von Willebrand factor VWD. So von Willebrand disease is the most common inherited bleeding disorder due to deficiency of von Willebrand factor. Now about the clinical presentations. In VWD, there is mucosal bleeding, epistaxis, menorrhagia, bleeding after dental extractions. It is an autosomal dominant condition. Remember, autosomal dominant conditions, rule of von Willebrand factor is that it causes facilitate the platelet adhesions to the endothelial cells and promote platelet aggregations. So, deficiency of VWF causes the defects of these functions. Investigations. Investigations of von Willebrand disease is that two abnormalities, that is bleeding time and activated partial thromboplastin time. So, in von Willebrand disease, there is prolonged bleeding time and prolonged APTT. Factor 8 is reduced defective platelet aggregation with ristocetin. Management. We manage VWD by tranexamic acid for bleeding. Desmopressin raises VWF and factor 8 concentrations. Look the right-sided box that von Willebrand disease, there is superficial bleeding and it is an autosomal dominant conditions. If we differentiate from hemophilia, what happened in hemophilia, that is deep bleeding and it is an X-linked recessive conditions. Look the images, there is bleeding presence, there is gum bleeding presence. Now there is a question come on FOP exam that Pratham mean time normal, APTT is prolonged, boy with gum bleeding and mother has the same condition. So there is gum bleeding, one of the history of bleeding, and another point is that mother has the same condition, that is we know von Willebrand disease is an autosomal dominant condition. So diagnosis is von Willebrand. So this is all about von Willebrand disease. Please do subscribe and share my channel. Thank you.